polycythemia. So we are going to look at the polycythemia types and looking at some differences among them. So we are going to ask one question. So in case of hypoxia, describe its components such as the plasma volume, the RBC mass, oxygen saturation, as well as the EPO concentration in all these aspects. So in this video we'll find out these answers and learn a lot more. So to begin with, we look at firstly the type of the relative. So there is the relative polycythemia. So what is meant by the relative polycythemia? So here under the plasma volume, it is decreased. Then we move on to the RBC mass. So what about the RBC mass? So under RBC mass, it remains normal. And what about oxygen concentration? Oxygen concentration is also normal. And then we look at the EPO concentration. So how is the EPO concentration? It also is normal. So this is with respect to the relative polycythemia, the PV is reduced. Next, we will look at the polycythemia vera. The polycythemia vera. So under the polycythemia vera, this includes the presence of increase. So polycythemia vera, it includes the increase. So what does increase in the polycythemia vera? So the plasma volume increases in polycythemia vera, as well as the RBC mass also increases. Then EPC producing, then the oxygen saturation, it remains normal, whereas the EPO concentration, it decreases. This is the only place where the EPO concentration decreases. That is the polycythemia vera. Next, we will look at the EPO producing tumors. So EPO producing tumors. So under EPO producing tumors, how is the PV? EPO producing tumors, the PV, it remains normal. And the oxygen saturation, if you see also, it remains normal. So the PV and oxygen saturation, it remains normal. RBC mass is increased and the EPO score is, EPO concentration is also increased. So there are two things increasing, the RBC mass and the EPO concentration. Next, we are moving on to the hypoxia. So in case of hypoxia, this the plasma volume remains normal, whereas the EPO concentration, it increases, and the RBC mass also increases. Then the oxygen concentration, it decreases. Next, we'll be moving on to answering our question. So the question we asked was nothing but the hypoxia. So hypoxia, we just did it now. So hypoxia, the plasma volume, as we discussed, it is normal. Then what increases? There is increase in the RBC mass, as well as there's increase in the EPO concentration. So there's decrease in something. What is the decrease in? There's decrease in the oxygen saturation.